Good morning, everyone. I'm Emily Beauregard, Director of Kentucky Voices for Health. Thank you for joining our webinar today. Hopefully everyone can hear me. You should be in listen-only mode at the moment. We wanted to have this webinar to unveil the new Kentucky Medicaid Tracker website that we released last week. This website is a collaboration of 3 Insure Kentucky campaign partners. The heavy lifting was really done by our friends at the Kentucky Center for Economic Policy, and we had some input into this as well, along with the Kentucky Equal Justice Center. And so together, we've created this website to track changes in Kentucky's Medicaid program since 2014, when Kentucky expanded the program to include more low-income adults. And the website is really devoted to keeping record of what's changed, to show how these changes are affecting Kentuckians, and to provide transparency along the way. So today we wanted to do a short demo of the site for you to help folks get more familiar with the data, the resources, and the tools that it offers. And after the demo, we wanted to take the opportunity, since we have everyone on the phone, for our friends at the Kentucky Equal Justice Center to give us a quick update on the Kentucky Health Waiver litigation. And then we'll open the call up for Q&A. So just a few housekeeping items to mention before I turn the webinar over to Dustin from KSEP. We're recording the webinar today. We'll be able to share that in a follow-up email. We also have a lot of folks on the line, so we're keeping everybody in listen-only mode. And once we get to the Q&A section of the call, we'll open the lines up. If you have questions or something that you want to add to the conversation before Q&A, you can use the chat box on the screen. So I'm going to turn it over to Dustin now, and he's going to walk through the website.
Hey, everybody. This is Dustin Pugel from the Kentucky Center for Economic Policy. I'm a policy analyst there, and I work on Medicaid policy, among other safety net programs.
Give us just a second. We're going to try to take care of whatever this noise is.
The conference has been muted.
Okay. Hopefully that should take care of things. So, Dustin, you want to start over?
Sure. Rich, can you hear me? Just testing. Got it. Okay. Okay, well, we'll start over. That was not my intro music. I'm not sure what that was. So just to reiterate, I'm Dustin Pugel. I'm with the Kentucky Center for Economic Policy, and I really just wanted to run through sort of the core of the information we present in this website, and then Emily's going to go over some information we're trying to collect with this website. So just to back up a second and, again, reiterate some of what Emily said, you know, this website was something that we sort of conceived of, months ago when we assumed that the Medicaid waiver was going to be implemented around now. And our hope was to really track what was happening in as close to real time as we could through both data visualization, through sort of a journal of what was going on, and also by presenting documents that we felt like were sort of scattered across multiple websites. We just kind of wanted to keep that in one place. And our hope was to just make sure that lawmakers, the media, and the general public were apprised of changes as they were happening, in a sort of somewhat neutral format. So today I just want to run through exactly what we've put together so far. And let me say at the outset, we really view this as a dynamic website, something that we can change and adapt as time goes by. The impetus for this was, some of the major changes that were proposed under the Medicaid waiver, but we don't view it as being limited to that. So as folks have ideas, as they, it's very possible you'll see typos or errors. As those come up, please reach out to us, and we're really open to that feedback and making changes. And I'll sort of highlight specific ways we would like your all's feedback as we go. So on this first page, we really wanted the landing page to be a place where you could get a sense of a snapshot of Medicaid right now. according to the data that we have been able to collect up to this point. And so as you land, we kind of give a brief description, kind of like what I just did. But then as you scroll down, there should be 3 visualizations so far. The first is just a look at where enrollment is right now and sort of tracking where it's been over the past year and a half. So, all these visualizations are interactive. So if Angela scrolls over the line there, it should pop up and kind of tell you each data point as you go through. I just invite you all to explore that. If you want an Excel spreadsheet with this data, there's a button below each visualization where you can click on that and it will download the data that we use to build out that visualization. So, Angela, if you want to scroll down. The next is just a county by county look. I make maps all the time, but we felt like this would be a very useful way of presenting the information, especially for local media or local lawmakers or just folks who want to know who of their neighbors are getting to see a doctor because of Medicaid. It also breaks that down by traditionally eligible children and adults versus expansion folks, because we felt like each of the different populations have different circumstances, and also the changes that are being proposed affect each group differently. And then if you want to scroll down one more time. And then finally, we have this graphic at the bottom, which shows the various reasons that we've received from the state for why people end up moving off of Medicaid. I think we try to be pretty careful to say that just because someone moved off doesn't mean they stayed off. There's often a lot of what's called churn within Medicaid, where people move on and off for various reasons. And I will admit that some of the wording within these categories might be kind of confusing, and I understand that. Honestly, sometimes they confuse me because this is just how the state gave us the data. But for the main reasons, I think they're pretty self-explanatory and clear. But this is something we plan to continue to update. And I also don't know that we'll stop here. It just depends on what data becomes available to us. But we plan on continuing to add visualizations over time, maybe ending up at around 5. We probably won't do more than that. But if you have data sets that you think would be useful to visualize here, or if you have ideas of open records requests that we can make to the state, we would really love to hear that feedback. I think we also, based off some early feedback, plan to include when these records requests were received, and then also talk about any outstanding records requests that we plan to use to update this dashboard. So let's move on to the timeline. So while this is loading, one thing that we felt would be very useful is just kind of keeping a record of what happened and when. The last 4 years have been very tortuous. There have been a lot of twists and turns. I think a lot of times people kind of forget what has happened up to this point, or when decisions were made or announcements happened. And so we really wanted to have one place where we could kind of keep a record of that over time. And it's still loading. Gotcha. Okay. So, each of these, as much as we had an ability, each of these different points in time should have a link to either a press release or a news story or some kind of source that kind of, explains more about what happened in that moment. But it is chronological, so you can start from the most recent change that we decided to record and go all the way back to May 9th, 2013, when the state decided to expand Medicaid. Okay, here we go. So I've pretty much explained everything about the timeline up to this point. The only thing I didn't explain is that on the left-hand side, there is a list of months and years, and you can use those to just skip down to a different point in time. So if you're thinking, well, around August 2017, I think that's when the state requested some modifications. You can skip down there, and it's pretty clear that, yeah, July 3rd. So I was a month off, but pretty close. So, yeah, I just encourage you all to browse this, and if folks, hopefully, in the future, if you're wondering, when did that happen, we're hoping that this will be a pretty permanent place to keep record of things. Again, if you all are looking through this and you see things that are not included that you would like to be able to have in one place, reach out to us. It's very easy to add things. If you have a news story or a press release to go along with it that you want to send to us, that would be great, so that we can link to it. But yeah, we are very open to adding to each of these different events. Let's go into the resources section. So I mentioned earlier that we wanted to have one place where documents from sort of disparate parts of the internet and people's files could be stored in one place. And so we decided to create a hub that we're just calling resources, where there are various types of documents related to Medicaid that you can download with a brief description under each. So there are things like contracts, there are things like court documents, there are things like state agency documents, there are federal letters of approval and guidance. We also have, here we go. Yes, I'm just waiting for it to load, if it's going to load. Yeah, I think it is. That's weird. Anyways, yes, we included public comments, and if it decides to work one day, you should be able to check that out. I'm not sure why. Yeah, we might have to reach out to them. It was working this morning. In any case, it's also searchable. So if there's a document you have in mind that you can't find right away, there's a search bar, and you should be able to look for it. So with that, I'm going to hand it over, and hopefully the Share Your Story page will load.
Yeah, all right. That one did load, so we're in luck. This is Emily again, and I have a feeling that many of the folks on the phone are pretty familiar with some of the surveys that Kentucky Voices for Health has used in the past to collect comments and examples of Medicaid barriers that people are experiencing. Over the past 3 years, we've had thousands of Kentuckians weigh in on Medicaid policy changes and system issues. So we wanted to use this website as an opportunity to provide a more permanent place to capture that kind of feedback. And that's what this Share Your Story tool will do for us. This tool is going to help keep us in the loop about how Medicaid changes are affecting recipients, their loved ones, those who help care for them. And it's really an opportunity for us to have more of a feedback loop. We want to share information with the public, and we also want to receive information so that we can keep our finger on the pulse of what's happening. So we can kind of go through this tool so you have a better idea of what we're asking for and who we're looking to receive input from. So you can see it starts with kind of who you are. And we're not only looking to hear from Medicaid recipients, although we certainly want Medicaid recipients to be aware of this tool and to share their experiences with Medicaid changes, but we also know that families are important. Families are often the ones that are assisting Medicaid recipients with paperwork or with trying to schedule appointments, even with making copays, trying to get transportation set up. So we want to make sure that family members have a place to share their experiences, as well as anyone else who's assisting a Medicaid recipient. So that could be an application assister, a community health worker, a Medicaid provider, really anyone that is going to be providing some sort of assistance and knows enough about the issue that they can relay that information to us. So we've tried to keep those options open. And then we also want to have an opportunity for the general public to comment if they have an opinion or some sort of input that is important to share. And so then we ask questions about people's general experience with Medicaid. We ask, of course, for some demographic information to help us better understand who we're hearing from and get a sense of the different populations and the different perspectives. And then we want to know some general facts. If you click on, Angela, if you could go up and click on the Medicaid, I have Medicaid coverage option, it actually then sort of accordions open, I don't know the right term for that, to some additional questions. So we built in logic to make sure that we're asking the right questions to the right people. If you say you're a Medicaid recipient, we're going to ask you specific questions about who your MCO is, or if you have direct fee-for-service through a 1915C waiver. We also want to know if someone is aware of whether they're on traditional or expanded Medicaid. We realize not everyone will. And then what type of problem someone has with their coverage. And then we have an open-ended box where people can tell us more. And in the surveys that we've done in the past, this is really where we get the most information, the most rich data, is when people just have an opportunity to explain the circumstances of the situation. And we've been able to really find, common themes there and trends that help us understand whether there's a system issue going on or something else happening. And then we ask people to tell us a little bit more about themselves in terms of demographics, because we realize that, there are a lot of system issues here. There are also issues in communities and in people's lives that can complicate whether it's being able to complete the paperwork or afford the copays or get to an appointment. There are things that can make it more challenging to get the care that you need. And so we want to understand what some of those issues might be. And then we ask for age and zip code. Zip code is especially important for us because we want to be able to look at coverage changes or utilization changes around the state and know if something is changing more in one area compared to another. This also gives us the opportunity to take the data, look at it, by zip code and communicate that data to public leaders in that area, so legislators or other policymakers that might be serving a particular area of the state. And at the very end of the survey, we ask people if we can share their story. And we want to make sure that people have the opportunity to share, but also know that they can report something anonymously if they're uncomfortable with sharing. So we give people those options and ask for contact information, which is optional. And that's the end of the collector. And this is something that people can take more than once. If something happens, again, another experience that they have that they want to report, they're welcome to do that. This isn't just a one-time tool. And so we are encouraging all of our partners to take this and share it with their networks, share it with Medicaid recipients, with Medicaid providers, and encourage them to use it when they have something that they feel is important to report so that we can start to identify these themes and trends and put our finger on what might be happening and whether or not there's something that we can resolve with the system. These stories are a really powerful way to illustrate the impact, whether it's good or bad, of changing Medicaid policies. And the more stories we collect, the more effective we can be in demonstrating what's working and what isn't working. And we're going to, as I said, be able to share this with policymakers. We can share this data with the state and really look for opportunities to resolve system issues or to make improvements. And I think that is something that everyone will benefit from. So sorry, I just lost my train of thought because I was trying to decide if we'd gone through every part of it, which I think we have. The resource page is back up. So now you can just take a quick look at that and see how it's laid out. I think Dustin did a really good job of kind of describing it. But on the left-hand side, the categories give you a sense of what you can find here. And as he said, if you have any documents resources that you think are worth sharing on this page, we can add those. So think of this as a library that we can continue to expand. And public comments, so I mentioned, we've been collecting comments, stories from people for years now, and we're actually including that on the resource page so that you can easily see what the general public has said about these Medicaid changes and when these comments, were actually submitted to either the state or the federal government. And so I should mention, if just back in March, there was the second ruling on the Kentucky Health Waiver, and if you didn't read through the 60-plus page document like we did, you might have missed the fact that the judge actually mentioned public comments about 35 times. So I think that's a real testament to how many people weighed in and how seriously the judge took those comments when looking at the potential impact of the proposed waiver. So I think that tells us that, having people continue to share comments, share input, and share their stories, their experiences with Medicaid changes matters, and it matters more, whenever we're able to share that information with the public and with policymakers. So with that, I think we should probably share the contact screen. That really sums up what we have right now on the website, and we want this to be a useful tool. So if you have suggestions for changes, for edits, for additions, you can reach out to us. Anna Bowman is our primary contact, and her information is there. And then you can see, again, who the partners are for this website. And I wanted to turn it over, before we open it up for Q&A about the website and any of the content that we just shared, I want to turn this over to Rich Seckel with the Kentucky Equal Justice Center to give us a quick update on what's happening with the Medicaid waiver litigation. And just one point to make is that, right now, this, as Dustin mentioned, this is really a dynamic website. We understand that things are changing constantly, and, the status of the Medicaid waiver, is still in limbo. We're still waiting to see what the ultimate decision will be in the courts, and that could, drastically change Medicaid here in Kentucky. So we're really trying to keep our finger on all of these things that are happening, and we want this website to be a go-to place with the most up-to-date information possible. So, Rich, if you've been unmuted now, I'll let you give us a quick update, and then we'll go to Q&A. I'm not hearing you yet. I don't know if you have your phone line muted or... Okay. Well, we may have lost Rich. Why don't we just go ahead with the Q&A if you want to unmute everyone. Were there any...
The conference has been unmuted.
Angela, were there any comments that people sent in through the chat box? Okay. So the line is open if people have questions or comments.
This is Debbie McAfee. I have a couple of questions. My very first question is, can reports be generated from this website by a user? I didn't see a report screen up there.
Debbie, what do you mean by that exactly?
Well, there were, when you get to the section where you were getting information from people, can you pull a report that shows all the information that's in there for people who have a certain issue with Medicaid, such as they were kicked off and they don't know why and they couldn't get back on, or I can't see the screen right now, so I don't know what to give you as an example, but
I think I understand your question now. No, not publicly. There obviously we can see the responses on the back end, and we say up front in the story collector that we plan on sharing your story, but without planning to share any identifiable information. Now we do plan on making the results of that collector in some way part of the dashboard on the front as we start collecting more sort of a critical mass of information. But initially, we don't plan on right now the website doesn't have the functionality to be able to pull a report necessarily. It might be that in the future when we have a decent amount of data that we might export it as an Excel spreadsheet and then get rid of any kind of identifiable information and allow that to be downloaded. But for now, there's not a way of generating reports.
Right.
Well,
so
I just have a suggestion. I mean, I think you can generate reports for certain issues. I mean, if you put a report module in there, you would just not have the ability to generate reports about stories. You just don't create any reports that would affect the story section, and then only an admin type of person would be able to look at that
right.
A report.
Yeah. So, Debbie, we do plan to look at the number of people who say, for instance, that they have an issue with filling a prescription, or they're having a problem with updating their address or some sort of paperwork issue. Maybe there's been an issue with getting through the DCBS hotline, or somebody's lost their coverage. And we can quantify those in terms of number of people who have reported the same issue and share information like that. What Dustin was saying was, of course, we want to collect data for a while so that we have a good sense of how many people are experiencing these issues. And the ones that we're going to really focus on are the ones that seem to be trends that are popping up more and more. And for instance, pharmacy copays became a trend recently. We started to notice that we have a copay collector, and people were saying that they were being turned away at the pharmacy, and many of these individuals, we found out, are below 100% of the federal poverty level. And as we started to dig into this, we realized, we learned from a pharmacy that they don't use the Kentucky Health Net system that all other providers, Medicaid providers, use. So they weren't able to see who was above or below the poverty level, and that indicates whether or not you can actually turn someone away. And so that helped us to identify the issue that was causing this kind of trend to happen. We contacted the state, and they actually sent a letter to pharmacy directors just a week or two ago telling them that they needed to be tracking this information and where to find it in their systems. And so these are some of the ways that we can use this data, but we're going to be looking for trends.
So in the back end of the system, and by back end I'm kind of referring to someone with administrative ability to be able to access, but also the back end of the system which doesn't face the regular use. You
Right.
have the ability to pull some type of
Yes, we get the full report. Yeah,
Okay.
yeah, we do. So that's information that we have, and we'll use it in different ways. Rich is on the line now, so why don't we go ahead and get our update on the Kentucky Health Waiver litigation, and then we can go back to Q&A.
This is Rich. Can you hear me?
Yes.
Okay. I was on the phone rather than computer audio. I'm Rich Seikel. I'm director of Kentucky Equal Justice Center. I'm filling in for Ben Carter, who's our senior counsel. We are co-counsel for Kentuckians who challenged the federal approval of the Kentucky Health Waiver. I'll do a brief update of that. On March 29th, the Judge Boasberg in the Federal District Court in Washington, D.C., for the second time vacated and remanded. In other words, said, Mr. Secretary, you shouldn't have approved this. I'm sending it back to you to think some more about it. The Secretary and the state of Kentucky appealed that decision, but in the meantime, everything that would require a waiver is on hold pending the outcome of the appeal. How's that going to unfold? Well, the Court of Appeals agreed with the government defendants to expedite the briefing process, so we're in the middle of it. The federal government in Kentucky turned in their briefs yesterday. Our brief for the plaintiffs is due on June 20th, and we expect the briefing will be completed in early August. And if the court wants to hear oral arguments, that could be as early September. And then the decision will come any time after that. There are a couple of elements of what Kentucky has proposed that don't require a waiver of federal law, and including the My Rewards accounts and the subsidies for private employer coverage. So those things are going forward. But things like the work reporting requirements and the new premiums and that kind of stuff are on hold. Be happy to answer questions as best I can. Again, I'm filling in for our senior counsel.
Thank you, Rich. All right, so we'll open it up again for Q&A, whether you have questions for Rich about the litigation or for us about the website.
And basically, here's our website. Here's what this link has on it. Here's what this link has on it.
Emily?
Yes.
Yeah, this is Sheila. I have a question for Rich. Rich, you mentioned that parts of the waiver could go forward, like My Rewards and CIHIP, the employer plan. I'm wondering about that medically frail status. Is that absolutely tied to the waiver?
I'm not an attorney, so I don't want to give a hard authoritative opinion, but my sense of it is that it is tied to the waiver, that the medically frail designation was a sort of companion piece to the work requirements. It recognized that not everybody's going to be able to meet the work requirements, and it was a way of letting people out of that. So it's intricately linked to that. Are you asking because of the connection with the co-payments?
Yeah, our technical advisory committee on behavioral health met yesterday, and we actually decided to make a recommendation that they revive that designation for the purpose of clearly identifying, and they had already identified some of the Kentuckians as being, quote, medically frail, and it would exempt them from co-pays. Now, whether they choose to do that or not, but I was curious about it. I agree with you that it appears to be tied to the community engagement. But since they're going ahead, they're also going ahead, obviously, with the expanded coverage for the substance use disorders, which was included in the waiver, but we knew all along was not necessarily requiring the waiver to be approved. So just curious about that. I might run that by Ben when I get a chance also.
Sheila, this is Emily, and I'll just add something to what Rich said. It's correct that there's a link between the medically frail status or that designation and the work requirement or the community engagement requirement, but it's also connected with the benefit changes. So another component of the waiver that we haven't talked about today is that the expanded adult group, so Medicaid expansion members, in the waiver have their benefits reduced. So it turns into two benefit packages. One is called the state plan, and that's all current benefits. The other is called the alternative benefit plan, and these are, CMS Medicaid terms. And the alternative benefit plan is something that you can have with or without an 1115 waiver. something you can request through a state plan amendment of, CMS, as long as you're, falling within the lines of what they require. So there are some required Medicaid benefits and some optional. Dental and vision happen to be optional benefits, unfortunately. But the state has opted to provide those benefits to all Medicaid recipients, and that's the current status. Everyone has access to dental and vision benefits. Whether under a state plan amendment or Distal number 15 waiver, the state can create this alternative benefit plan. And any state that has an alternative benefit plan has to have a medically frail designation. And that designation, in this case, because the waiver also includes a work requirement, would both exempt someone from those benefit changes as well as that work requirement. But I believe, and I do think that Ben probably could give us more of a legal opinion on this, I think the state has the option of voluntarily, adopting a medically frail designation that could be used. They've already built the tool. We already have this algorithm to, identify people who are medically frail based on their claims data or an attestation from a provider. And so I think there's the option to request of CMS that you have this designation to exempt people from these mandatory copays, because we know that people who are medically frail need to use, services more often, get more treatment, more prescriptions, and so have more of a copay burden and could end up either, rationing their care or just not going at all when they need to seek care for their health. So I'm with you there.
Great. Okay. Thank you very much. I appreciate that.
Excuse me. I'm sorry. This is Debbie again. Could I ask a clarifying question on what you just said? From what I want to make sure I understood it correctly. The state has the option to implement an alternative benefit plan, but at the current time, they have not. Is that correct?
That's correct.
And I guess this kind of goes to you or Rich. The My Rewards accounts, they're still open just to accumulate points for any future implementation of the waiver?
That's right. The incentive piece of this, which is being able to take, online courses or earn My Rewards points for things like preventive screenings, that exists now, and that is still active. But so people can accumulate, but no one can spend those My Rewards dollars on care because the waiver hasn't been implemented, and quite honestly, no one needs to right now because dental and vision benefits are still available to everyone. So if people spend the time accumulating those benefits, it could be for nothing at the end if the waiver never goes into effect, or they may be able to use them in the future.
Okay, thank you.
Are there any other questions for Rich about the litigation or for Dustin and I about the website? All right. Well, thank you all for joining us today. I hope that the website is intuitive and easy to navigate and use, and we welcome your ideas.
Thank you very much. Looks great.
Thank you, Sheila.
Thank you.
Bye.
Thank you all.